Hello and welcome to the basic informational video for cardiometabolic syndrome. Larger your waist, shorter would be your lifespan. This video has been prepared under the guidance of Dr. Kotha, and you can obtain more information on cardiometabolic syndrome at www.heartsmartglobal.com. Let's see what cardiometabolic syndrome is. It's actually the name for a group of risk factors which are linked to overweight and obesity. These risk factors increase your risk of heart disease and other health problems like diabetes and stroke. The term metabolic refers to the biochemical processes involved in the body's normal functioning. Risk factors are traits, conditions, or habits that increase your chance of getting a disease. So what are these risk factors? Patients with cardiometabolic syndrome have 3 or more of the following risk factors like a large waistline related to the belly fat, hypertension also called high blood pressure, high triglycerides count, low HDL or the good cholesterol, and high blood sugar ultimately resulting in type 2 diabetes. The following is a graph of the metabolic syndrome's hazard as compared to a healthy population. You will see that on the x-axis follow-up in years is plotted, and on the y-axis cumulative hazard is plotted in percentages. First, we must know our numbers. What should be our waist circumference, which is a very significant component of the metabolic syndrome? It is very easier to measure, and everybody can measure their own comfort. So typically waist circumference should be less than 35 inches in men and should be less than 31 inches in women. Your non-HDL cholesterol can be obtained by deducting your HDL cholesterol from the total cholesterol should be less than 130 milligrams per deciliter. Your HDL cholesterol should be greater than 40 milligrams per deciliter in men and should be greater than 50 milligrams per deciliter in women. HDL cholesterol is the good cholesterol, and the more it is, the better. Your triglycerides should be less than 140 milligrams per deciliter, and your blood pressure should be less than 130 over 80 millimeters. For people with diabetes, blood pressure should be less than 120 over 70 millimeters. Your LDL cholesterol should be less than 100 milligrams per deciliter. For people with diabetes and known coronary artery disease, LDL cholesterol should be less than 70 milligrams per deciliter. How to measure your waistline? In order to measure your waistline, place a tape around your bare abdomen just above the hip bone as indicated in this picture. Make sure that the tape is snug and it should not be compressing your skin. The tape should be parallel to the floor. Relax, exhale, and measure your waist. Here is a table which shows the recommended waist sizes in inches for different population groups and for men and women. Here is the same table which shows the recommended waist sizes in centimeters. Here is a graph which shows the prevalence of cardiovascular disease in adults who are 20 years of age and older. Here is another graph which shows the deaths due to cardiovascular diseases like heart disease, stroke, and peripheral artery disease. It has been plotted from the year 1900 to 2007. You see how the line is increasing. Let's see some statistics from the American Heart Association. Heart disease is considered to be the leading cause of death in the United States. This year alone, 1.2 million Americans will have a heart attack. And this year, 795,000 Americans will have a stroke. 65% of all people with diabetes die from heart or blood vessel diseases. Here is a map which shows the number of deaths in thousands due to heart disease in each region per year. This map has been obtained from World Heart Federation. What are the symptoms of a heart attack? There are gender differences in the warning symptoms for heart attack. In men, the symptoms are discomfort in the center of the chest experienced as an uncomfortable pressure, squeezing, fullness or pain which lasts for more than a few minutes or goes away and comes back, discomfort in one or both arms, the back, neck, jaw or stomach, shortness of breath, cold sweat and nausea or lightheadedness. In women, the symptoms are sometimes women may or may not have chest pain. They are more likely to experience some of the other common symptoms like shortness of breath, nausea or vomiting, and back or jaw pain. Earlier we have seen the number of deaths due to heart disease, and here is another map which shows the deaths due to strokes in each region per year. Again, this map has also been obtained from the World Heart Federation. Let's see what a stroke is and how does it occur and when does it occur. Stroke happens when blood flow to a region of the brain is interrupted due to the blood vessel in the brain that is blocked from a clot or is torn and is leaking. If the blood flow is stopped for more than a few seconds, the brain cannot get blood and oxygen. So what happens is brain cells die, causing permanent damage. Let's see what are the symptoms of strokes. Again, they vary between men and women. In men, the symptoms are sudden numbness or weakness of the face, arms or legs, sudden confusion or trouble speaking or understanding others, sudden loss of vision in half the visual field, sudden trouble walking, dizziness or loss of balance or coordination, sudden severe headache with no known cause. In women, the symptoms of stroke are sudden face and arm or leg pain, sudden hiccups, sudden nausea, sudden tiredness, sudden chest pain, sudden shortness of breath, and sudden palpitations. Here is a map which shows the number of deaths attributed to diabetes in the age group 20 to 79 years. And this has been plotted for year 2010. Prevention. How do we prevent cardiometabolic syndrome and the diseases associated with the syndrome? Generally, it's recommended to exercise for at least 30 minutes every day. Children need to exercise a little longer for up to an hour and hour and a half a day. The table here shows the number of calories burned for different activities. Here is the pyramid which shows exercise breakdown over a week. This pyramid can also be obtained on www.heartsmart.info and heartsmartglobal.com. Here are some nutritional facts. 10% weight loss is associated with 30% loss in adipose tissue. Restrict total calories, especially from simple carbohydrates. Start consuming more calories from mono, poly and omega-3 fats. Some rich sources of omega-3 fats are oily fish like salmon and flaxseed. Start reading nutrition labels on food items to see calorie and food intake. Here we show how to read the nutrition labels, like where to start from, and then check on the number of calories, limit nutrients like total fat, cholesterol and sodium. Try to get enough of vitamin A, vitamin C, calcium and iron. Bake, broil or barbecue. Stop deep frying and reheating the edible oils for cooking. Eat at least 5 servings each of fresh fruits and vegetables a day. Balance your omega-3 and omega-6 oils. Olive oil, canola oil, nuts and avocado are rich in monounsaturated or good fats. Flaxseed, oily fish like wild salmon are rich in omega-3. Sunflower oil, safflower oil and soybean oil are rich in healthy polyunsaturated fatty acids. Avoid sugars, white flour, polished rice and colas. Avoid trans fats, crispy and crunchy, fried and fast foods, desserts, cookies, cakes, pastries and lower your salt intake. Practice yoga and medication. Quit smoking. Take medications under your physician's supervision to achieve the target numbers. Our contact information. You can obtain all this information and much more on www.heartsmartglobal.com. You can follow us on Twitter and also become a fan on Facebook. We have just recently released an iPhone application called HeartSmart iGlobal. You can search for HeartSmart iGlobal in your iTunes on the Apple Store, and you can download this app on your iPhone or iPad and iPod. This is a very good ethnic friendly risk calculator. It has some very good informative slides, and it also calculates your risk or chances of getting a cardiometabolic syndrome, and it will show you some of the lifestyle modifications you need to do in order to prevent cardiometabolic syndrome and the diseases associated with this syndrome. Thank you very much for watching our informational video. We wish you good health and good luck. Thank you again.